The requirement to wear a mask in public buildings is gone, but special obligations for employers remain. According to the new Code of Conduct by the Department of Employment and Labour, employers can still demand mask wearing in the workplace. For a discussion on this, I am joined by the department's Senior Specialist in Health and Hygiene, Bulelwa Huna. Bulelwa, thank you so much for your time and thank you for joining us. Now, Labour Minister Thulasini Nxesi republished the rules last Friday, 2 days after government dropped the mask mandate. Can employees waltz into the workplaces without masks, and do national rules override those of the workplace?
Actually, there is no conflict between the rules that are given by Department of Health and what the Department of Employment and Labour has gazetted. The code that has been issued by the Minister must be read with the regulations for the biological agents and the Occupational Health and Safety Act. Because it's not a rule across the board that employees in the workplace must wear masks. Employers are required to use a risk-based approach and conduct a risk assessment. Because workplaces differ. There are workplaces whereby they intentionally work with SARS-CoV-2, like in the laboratory settings, where they have to test the samples and so forth. In the hospitals, there the controls will differ. But in the general workplaces, whereby they do not intentionally work with SARS-CoV-2, which has resulted in COVID-19. It is a risk-based approach. The employer must determine what are the relevant control measures, and that will be based on the risk assessment. If the risk assessment requires the employer to implement physical barriers, those that we call engineering controls, you see them with the cashiers and also people working in cubicles, and all still requires them to disinfect, sanitize, and also use masks. That is a legal requirement. So if that workplace still requires mask wearing based on the risk assessment, then they must comply with that.
So what you're saying here, Bulelwa, is that employers can identify a high-risk area such as a specific division or department and enforce mask wearing only for those affected and not necessarily for the entire company if they want to.
Yes. When you look at the workplace, it's a dual responsibility. The employer is supposed to conduct that risk assessment in terms of the law, implement controls, and also inform the workers about the results from that risk assessment. Where that risk assessment is conducted, this time is conducted in consultation with the health and safety reps and the union reps as they represent the workers. Then the results must be communicated to the workers. And then in terms of the law, the workers have got the responsibility to look after themselves, meaning that they must cooperate with the employer on the instructions given. Meaning that if me as Bulelwa coming to work, I've got symptoms, I've got a duty to protect myself by wearing that mask, even if the employer has not told me so. If I feel that I'm not okay, so I can protect myself and also protect others. So it's a dual responsibility.
Speaking of that risk assessment plan, I mean, the regulations formerly known as the Code of Good Practice Managing Exposure to SARS-CoV-2 in the Workplace require employers, like you said, to create a risk assessment plan. Would this plan be a joint effort between the employees, the unions, as well as the employer?
Yes. In terms of the law, because when you go to the OSH Act, we require the Mother Act, the health and safety representatives have one of their functions is to look into that risk assessment, give inputs, and also give inputs on the control measures that are going to be put in place. Also, when you look at the regulations for other biological agents which regulate SARS-CoV-2, they must also give input. Now that we have health and safety is a fundamental right as of 10 June 2022. Convention 155 is very important and it gives the rights to union reps that they must also have a say when it comes to health and safety rep, meaning that when that risk assessment is done, the shop stewards and the health and safety representatives together with the committee must give an input. So truly, it is a joint effort.
It certainly is. Now, employees or rather employees who refuse to be vaccinated, you say they must be reasonably accommodated. What is deemed to be reasonable?
Each workplace differs. If vaccination is not a new concept, there are healthcare workers are vaccinated for hepatitis because the risk assessment even with SARS-CoV-2, will determine the nature of the work that is done, and that risk assessment is a legal document. If based on that risk assessment, vaccination is one of the control measures, then the employer will inform the workers, but then look at accommodating those because of health reasons cannot be accommodated and finding alternative ways of protecting them. But everything is based on the risk assessment because it's like your insurance document where you detail everything and the control measures that you are putting in place, which must be complied with.
So, Bulelwa, then can employees who feel that they are at risk of contracting COVID refrain from work until the enforcement of masks is implemented throughout the company? Do they have that right?
In terms of the risk assessment, if it is a high-risk environment whereby masks are part of the control measures, they have a right to refuse working in that dangerous environment in terms of the code. However, in a general work environment, like I'll make an example, in the retail sector, that employee does not need to wait for the employer to say wear a mask. Even if the risk assessment says masks are not required, that employee, if he or she feels that they must still wear the mask, they can wear their own mask and protect themselves because he or she has still got the responsibility to look after themselves. Because refusing to work, there must be evidence that that is a high-risk environment, and then that employer will have to report that I'm not able to work in that environment and report to the supervisor who's representing the employer that won't be able to work in this environment because of these control measures that are not adequate.
Makes sense. Now, you're speaking of responsibilities. What responsibilities does an employer have with regards to educating and informing employees on the measures to be used in order to reduce transmission?
The employer, if their risk assessment says there must be physical barriers, there must be good hygiene practices, cleaning of work surfaces, disinfection and so forth, wearing of masks, sanitizing, they must tell the employees, train them, say that the reason we are putting these physical barriers is to make sure that we reduce the risk of transmission. We are protecting you, we are protecting other workers, and we also want to make sure that you go back home. This is our risk assessment. Based on the inputs that were given by the health and safety reps and the union reps, this is what we have identified. These are the risks when you do your work, if you are dealing with the public, when you deal with the public. Hence, we have these control measures to protect you. So the law also requires you to cooperate with me as the employer as I'm putting these control measures and obey the instructions that are being given. Because one thing we often forget, health and safety is a dual responsibility. The employer has got a duty to enforce the control measures that are put in place, and the employee has got a duty to cooperate. And then if the employee is not cooperating, that can also be a disciplinary measures that can be put in place.
Well, this is certainly different times that we're living in. Thank you so much for your input on this discussion. That's Bulelwa Huna, who is the specialist in health and hygiene at the Department of Employment and Labor, just unpacking there for us in terms of the rules and how we should be able to navigate our workspaces with the new rules around the wearing of masks.